gonna do just a quick team meeting before we go out in the field today. There's a bunch of updates, a bunch of things moving. The youth program launches next week with Viv. Maya's got a bunch of updates, really amazing updates on the legal work. And then got a lot of updates on the mobile crisis and the counseling. And then after we meet, the mobile crisis team is gonna go out into the community until 6. I'll be on the phones, intaking folks, and then at 5:30, Viv will be leading the canvas, spreading the word about the upcoming event we have with Circle of Brotherhood.
I know people are having a lot of questions around the name, Freedom House Mobile Crisis. One of the reasons why we chose the name, for those who don't know the history, the ambulance service in general in the United States was started in Pittsburgh when individuals in Pittsburgh, particularly in a black neighborhood, were saying that the police were responding to the individuals who had trauma, but they were not like really trying to save their life and really not trained to do those types of things. And so people in Pittsburgh were just like, we want to get together with the local hospital and be trained by the doctors and nurses there to do our own response. And they named it the Freedom House Mobile Crisis. And so yeah, and that actual system became what we now know as EMS in the United States. So if you get a question like, what's Freedom House or whatever, I think that would be a good introduction into why we're doing this. It's the exact same model that we saw out of Pittsburgh for the exact same reasons as well.
So when we go out and we respond to calls, we have a medic and trained crisis workers who respond to people who are experiencing mental health crises. And what that does is we are able to holistically look at the situation. We're trained in de-escalation, trained in mental health practices to be able to help the community, and we respond to the crises. So because we are looking at this holistically, we have a medical person, we have therapists, social workers on board. That helps us be able to assess and intervene quickly with specific systems in place so that we can really just help clients feel calm, help people who are experiencing crisis get back to an equal state where they can we can help them to achieve their optimal mental health.
The individuals that were showing up to intervene on behalf of this population, specifically in Liberty City, was not prepared, nor did they want particularly to take on this type of role in the community. And all throughout the country, we heard calls to defund the police, that we needed a different method of dealing with individuals that have serious mental illnesses, and yet there weren't a lot of programs that were being talked about across the country. And so the first thing we did was to get with a national organization called Interrupting Criminalization to see what other people across the country were doing. And then we went ahead to start our own model. Nothing like this in Miami-Dade County exists. When you have a crisis response team that shows up outside of the police department, people are less likely to get harmed, hurt, or even killed, in which they do now with the police intervening in these encounters.